Hi Saddam,
Hi.
thank you so much for coming. I have questions that I want to ask you. Are you ready?
Yes, I am.
Global health seems to be in the news more and more in recent years. Talk about what global health is and why it is important to pay attention to it.
Yeah, thank you very much, and I really like that question. So, global health is the worldwide study of science that helps people to prevent themselves against different diseases, and it also helps people to increase their life expectancies through fighting against different diseases. So, we need all to pay attention to it because it increases our ability as a world to fight against different diseases.
Yeah. Thank you so much. So disease come to us in different ways. Explain the difference between communicable and non-communicable diseases.
Yeah, thank you very much for that question. The communicable diseases are those diseases that can be transmitted from a, an infected person to a healthy person. They are caused by viruses, microbes, or fungi,
Yeah.
and an example of communicable diseases can be like HIV, AIDS. While non-communicable diseases are those diseases that are not transmitted from one person to another. So they can be like goiter.
Yeah.
Yeah, they are caused by different hormones and other substances in our bodies.
Yeah. So let's talk about Ebola, since I'm sure most of our viewers have heard a lot about that. What is it and why is it communicable or non-communicable, and how do people get it?
Yeah, thank you very much. First, Ebola is a communicable disease that people that people are infected, that is transmitted through the contact of people on their body fluids, especially the saliva when people are kissing each other, for example, or the sweets when people are greeting each other with sweets, or bloods when they are blood transfusion or they are giving each other bloods. So it is also it is just a communicable disease.
Yeah. So what would rise a person's risk of getting Ebola?
Yeah, thank you very much. A person's risk of getting Ebola would rise when a person is in the area where Ebola is found. Again, those people who are in charge of taking care of the Ebola patients, for example, those doctors,
Yeah.
friends, family members of those Ebola patients are highly at risk of being infected of Ebola.
Yeah.
Yeah, when they do not care about the usage of those protective materials such as surgical masks or gloves.
Yeah. Thank you so much. So to prevent or lessen the chance of getting Ebola, what should people do?
Yeah, to prevent the risk of getting Ebola, people need to care much about their mobility first. When you know that the place where you want to go is infected, people over there are infected with Ebola, you don't need to go there. Again, when you are in the place where patients are sick from Ebola, you need to protect yourself well and effectively with those protective materials, surgical masks and gloves.
Yeah. So outbreak as the one related to Ebola can generate a lot of rumors and misinformation and even panic about the disease. How is it transmitted and how likely people are to get it? Talk about the need for educating people about facts versus myths.
Yeah, myths of Ebola.
Yeah.
Yeah, thank you very much. Many people think that Ebola can be also transmitted through the usage of air and water, while it's not true. So, but as a real fact, Ebola is transmitted in body fluids.
Yeah.
So educating people about this is very helpful because they can be able to protect themselves and prevent themselves against Ebola through following different rules of taking themselves away of the place where Ebola is found, and also use effectively those materials to protect themselves.
Thank you so much. So how about the complication that Ebola raises for the right of travelers and the responsibility of governments? Kaki Kihox, for example, a nurse from Marine who returned to the US for a long trip to West Africa in the fall of 2014, promptly had quarantine-related restriction thrust upon her restriction that she was very much against. Briefly describe the difficulties of balancing individual rights and governmental responsibility.
Yeah, thank you very much. When it comes to sickness, to the regional or common sickness, the government needs to be involved.
Yeah.
So when the government restricts people to decrease their mobility, it doesn't mean that the government do harm those people. So it's only the way of protecting them, as it's the responsibility of the government to sustain the lives of its citizens. So also people need to understand it, because we need to have a good life, and whatever we do is to provide ourselves a good life. So I don't think that it's like a bad habit of protecting people away of Ebola. So it's a good idea, and people need to, even though it can be seen like their rights are not well fulfilled, but it's the way of helping them live their better life.
Thank you so much. Let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it do to our body?
Yeah, thank you very much. I really like also that question. Smoking is totally bad to our body.
Yeah.
And it affects negatively each part of our body. For example, starting on the brain, the smoking causes stroke, which is caused by the ineffective movement of blood from different parts of the body to our brain. Also in our eyes, when people smoke, their eyes are affected negatively, and they don't seem normal in their sight. Also, let's talk about the smoking in our hearts. Also, smoking affects our hearts, because the blood that is also circulating in our body reach also in the heart with bad air, which affects our heart breathing.
Yeah.
So smoking is totally bad, and we need to get ourselves away of it.
Thank you.
Yeah.
So, what about the second-hand smoke? Explain what that is and how it affects people.
Yeah, second-hand smoke is totally the smoke that is breathed out of the smoker's mouth, and it can be regained by someone who is closer to the smoker. It means when you are smoking, you can be smoking together with someone, and that one can also have a portion on what you are smoking.
Yeah.
So that one is bad, because we need also because it affects the body of the neighbor. Yeah. So we need also to be aware of it.
Okay. So people don't typically think of tobacco as a drug like heroin or cocaine, but the addiction it creates is strong, isn't it? Should we think of tobacco use as a form of substance abuse?
Yes, tobacco use is also a drug or other alcohol. It's also a bad habit to use tobacco, because it also affects our body.
Yeah.
And it's like also bad because, for example, in our lung does not function normally when we smoke. We use those tobacco stuffs. So we need also to fight against it in order to have a good life.
Thank you so much for your time.
Yeah, thank you. You are welcome.